the standard clinical treatment really fails exactly the in the attempt to decrease the pain itself, right? So clinical treatment for chronic pain patients essentially nowadays ignore the idea of decreasing the pain. They want functional recovery, which means learning to live with your condition as opposed to making the condition better. So in a sense, it's trying to convince people that, this is the best that's going to happen. You just have to sort of get around it and live with it. And which is all, I think, the wrong message of expectations. Instead, if you give them the proper positive expectations that in fact this pain can be controlled, that there are many different ways of controlling the pain. It's not one way, it's not one thing, it's not a drug, it's not a single exercise that's going to fix it. It's the whole history of living with the condition and all of the memories that are associated with it and all the emotional traces that come with it that have many, many different dimensions. And so Aivo tries to sort of attack all of these and at different levels, at different times, and in a way, both identifying to the person what it is that they have and how they can sort of come to terms with it and literally try to piecewise decrease the suffering associated with the condition. And that, yes, and if in a sense we want to decrease the pain of participants, period. And how much we can do that, that's going to depend on different people. Not everybody will get the same response. Some people will have amazing responses that they will be surprised about how they are feeling after years of suffering with the condition, and others will be more resistant. And the challenge is to be able to serve all of them at different levels. But I think continuous nurturing and continuous multi-dimensional following the pain over many, many weeks, even with the people who have more resistant pain conditions, I think we should be effective and we should be able to make their lives better